Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at what are pandemics, their causes, impact, and the prevention. Pandemics have shaped history, how we can prepare for them and be ready for the next one. So the purpose of this talk is to explore what is a pandemic, the history of major pandemics, causes of and transmission of major pandemics, the global impact of pandemics, and the prevention and the preparedness. So what is a pandemic? A pandemic is a global outbreak of an infectious disease commonly, though we can also talk about other diseases or other issues as pandemics, but mainly it is used for infectious diseases. So epidemics are usually localized, pandemics are spread, and they are usually worldwide. Some examples of major pandemics include the COVID-19, which we have just experienced recently. We have the HIV/AIDS, which was has been a major plague, and then we also have influenza pandemic. So we have some of the major pandemics that have happened, like the Black Death of 1347 to 1351, which killed over 50 million people in Europe. We have the pandemic of the Spanish flu, which happened between 1918 and 1919, which infected 1/3 of the global population. Then we have the HIV/AIDS pandemic of the 1980s up to the present, which has affected over 36 million people worldwide. Then, of course, recently there was the COVID-19 pandemic, which shaped the modern healthcare responses, and we know the impact it has had on the world economy, on the way interrelationship between people and communities. So what are the causes and transmission of pandemics? Usually they are caused by zoonotic diseases. These are viruses that are transmitted from animals to humans. We have heard of the COVID-19, Ebola, and then you also have global travel and trade, the worldwide movement of people leading to rapid spread, and also interconnectedness of societies. We have seen how COVID-19 moved from China in Wuhan, moved to various parts of the world, and it covered the whole world, and everybody worldwide was affected. So some of the things that can also affect the spread of pandemics include poor sanitation and hygiene, increases the risk of outbreaks. Diseases like cholera, when you have an outbreak in one place, it affects a few individuals who do not observe the necessary hygienic measures, and this leads to outbreaks and spread to other people. And even the COVID-19 pandemic, the measures to control it included hand washing, which is hygiene, proper cough techniques, and also wearing masks so that we do not spread the virus to other people. And this apply even in our daily lives as we try to cope up with some of the viral infections. It is important to observe hygiene. So what is the global impact of pandemics? Usually they have health impact where there is high mortality rate. You also have long-term health complications, like there is the issue of the long COVID. There are people who are still suffering the impact of the COVID infection, serious lung complications, the impact of HIV, people on drugs, long-term, transmission from one person to the next, affecting the sexual relationship between couples. And then there is the economic disruption. We have first had experience, businesses closed. There was the issue of the quarantine, and this led to job losses, market crashes, and also increase in healthcare cost. There was need for gloves, there was need for masks, there was need for sanitizers, there was need for ICU beds and the HDU, need for isolation rooms. So many things came with the COVID-19, and these had huge health impacts. Then there is also the social and the psychological effects. I remember the first time people heard of COVID-19, and anybody who people had had was infected, then there was that social isolation, and the people would tend to get away from the person, and this leads to anxiety of family members, and because we knew that once you get the COVID-19 initially, this was like a death sentence, and there was a lot of scare. So there's anxiety, there's isolation, and there's also changes in the daily lives. Of course, we know what happens if you have HIV. Though these days it is well controlled with drugs, but there's still precautions to take so that you protect your loved ones. The healthcare system strain, overcrowding in hospitals, and the issue of supplies shortages, including staff shortages, inadequate staff. There was a big strain on the health care staff during the COVID-19 pandemic. So what are some of the prevention and preparedness measures that we can take as a community, as individuals, and also as a country? One is early detection and surveillance. There are surveillance systems that are in place to monitor outbreaks in real times. When an unusual illness is noted, there is a reporting system which have been put down by the World Health Organization to help health care systems identify outbreaks and report them on time. Then there is vaccination and immunization. We know that COVID has been well controlled with the vaccination and immunization system, reducing infection rates and also the severity of the infections. There is also public health measures like social distance, use of mask, hand hygiene. It is always important to take these precautions, especially for flus and colds, that we maintain social distance, wearing of masks, and also hand hygiene, always washing hands, and this will help even control diseases like cholera. And this we should include even our children in school systems, so that kids learn to wash hands consistently. In one of my videos, I've talked about healthy habits for kids, so that they are able to also be able to live a healthy life. Then, of course, there's the public health measures we have talked about, and also public education, so that people know of the occurrence of an outbreak. Then strengthening the healthcare systems so that they are able to cope up with the new outbreaks. It is important to invest in research, good communication capacity and interlinkage between hospitals, and the information sharing in the healthcare system, so that we can be able to fight new diseases and new outbreaks together, and the global cooperation, so that the sharing of research information and resources to combat pandemics together. You realize how it was important for the low-income countries to get assistance, to be able to establish ICU, get the ventilatory machines, get the protective clothing during the COVID time. So it is important that we stay informed, we follow reliable sources for health updates. It is important that we support vaccination program to help build community immunity, and it is also good practice to practice good hygiene by washing hands, wearing masks when needed, and advocate for pandemic preparedness policies, and encourage the government to invest in healthcare resilience, so that in case there is an outbreak, we are always ready for it. So thank you for watching. Share your experiences of what you experienced some of these outbreaks and during the COVID pandemics, and possibly what are some of the learning points that you did learn that could help us prepare better in future. Thank you for watching.